I am Dr. Anju Jha, consultant dermatologist, skin specialist, practicing in Medieval Skin Clinic, Vaishali, Ghaziabad and Vasundhara Enclave, Delhi. I am also attached to Kailash Hospital, Noida. Today I'll be speaking on hair fall. Hair fall has been a concern of major depression and anxiety in most of the people, especially during the last 2 years of pandemic. Normal hair fall is 50 to 100 hair fall per day is considered to be normal. Anything more than this is considered to be abnormal. Telogen effluvium is considered to be one of the most important causes of hair fall. To understand telogen effluvium, let us know a little bit about the hair cycle. Different stages of growth. Most of our hair, that is 80 to 90% of our hair, is in growing phase or anagen phase, and 10 to 20% of our hair is in telogen phase or resting phase, following which there is shedding of the hair. Now, when our body undergoes trauma or stress due to any reason, then most of our hair, which is in growing phase or anagen phase, is converted into telogen phase or resting phase, and following after 3 months that hair is shed. Whenever there is hair fall, we always ask our patients about any history of previous illness in the recent past which existed 2 to 3 months back, because the hair is always shed after 2 to 3 months of the stress or injury to the body. The stress can be in the form of any ailment like dengue, typhoid, malaria, COVID, or any surgical procedure which the patient has undergone. It could be following childbirth. The other reasons for telogen effluvium could be deficiency, dietary deficiency, deficiency of vitamin B12, of vitamin D3, and other hormonal aspects also. The main important hormonal problems could be hypothyroidism, hyperthyroidism, chronic uncontrolled diabetes mellitus, or it could be in the form of any mental stress also. So actually we need to investigate properly as to what is the cause of this hair fall. The good part about telogen effluvium is that it is a completely reversible process, but the time taken for this process is mostly 4 to 6 months. So the reversal of the hair growth is there, but the time taken is 5 to 6 months, and we need to wait patiently for the hairs to return. Now, investigating a case of telogen effluvium, we need to take a proper history. We need to do certain investigations in the form of serum ferritin levels, because iron deficiency is one of the most common causes of telogen effluvium in our country. And then we need to also do vitamin B12 levels and vitamin D levels. Once the investigation is done and the diagnosis is made, then the treatment is started, and the treatment can be in the form of oral medications and topical medications depending on the age of the patient. The other important problem is thinning of hair. Many patients, they will complain that there is loss of density of the hair or on the scalp. So the hair fall is not much, but there is thinning of the hair. This is what we call female pattern hair loss in females and androgenetic alopecia in males. Usually the age group affected is from 4th decade, but these days we do see cases in as early as 3rd decade of age. In this type of problem, what happens is that the hair thins out and is lost forever, and it is not a reversible process. So whenever there is thinning of the hair, one should take prompt treatment so that the hair can be retrieved as soon as possible. So now we understand why it is important to diagnose the reason for the hair fall, because the treatment has to be done accordingly.